As you're starting your Medicare journey, or if you're already on Medicare, it's important that you understand what a Medicare Advantage plan is, even if you're not planning on going it, as you'll most likely receive marketing material, hear from friends, and so forth. So it's a good concept that you want to understand. So a Medicare Advantage plan can kind of come in two ways. One is an MA, and the other way is an MAPD. So an MA is a Medicare Advantage plan, but there is no Part D coverage or prescription coverage in the plan. Now these plans aren't as popular as they once were, and there's sometimes as few of them to be able to choose from, but they're usually for individuals that either never got Part D and they don't want to pay that Part D penalty later, or that they have VA benefits or some other type of prescription coverage that's as good as Medicare, so there's no reason to have that additional coverage. Now usually these MA plans can be found for $0 per month, however that can vary from area to area. Now the other side is that MAPD, or what's called a Medicare Advantage prescription drug plan. That does have the Part D included, as we can see there. So that means your prescriptions, as long as you choose the proper plan, will be covered under these plans. They work by using various pharmacies, networks, and so forth, so it's always good to check to make sure that whichever Medicare Advantage prescription drug plan you're joining covers your prescription at the lowest rates possible. Now that we covered what the difference is between an MA or an MAPD, let's talk about how Medicare Advantage plans actually work. Now they'll work more like traditional health insurance, meaning that you'll have things like copays, deductibles, and so forth. Now often you can find a Medicare Advantage plan for $0 per month, meaning you don't have to pay anything additional. However, you do need Medicare Part A and Part B in order to qualify. So you still have to pay that monthly premium for Part B. Now how they also work is they use things, as mentioned, like copays. So we'll use some examples here. So that means a beneficiary could expect to spend anywhere from $0 to $10 to see their primary care physician, we'll say. And then to see a specialist, we'll say they could spend anywhere from $35 to $45 to see a specialist. And again, these are just numbers that we're using as an example. There's also various other aspects of a Medicare Advantage plan. For example, to go to the emergency room, you could have to pay a $90 copay. Or to an urgent care facility, they could be $50. So if you're starting to notice a trend here, while you don't pay anything for the Medicare Advantage plan itself, it is broken up into copays and out-of-pocket expenses. Now the Part D usually does not cost anything extra, meaning it's built in to the plan. It's not a standalone plan, it has to be part of it. If you only go on an MA plan, you cannot also sign up for a standalone Part D. You need to go on a Medicare Advantage prescription drug plan. Now there's also auxiliary benefits in these plans. For example, many of them carry dental, vision, and hearing. Now it might not be the best coverage, however it is included and you do have to stay in network. Medicare Advantage plans, for the most part, also come in two aspects, a PPO and an HMO. Now the key difference here is on an HMO, you'll want to choose a primary care physician or your doctor that you'll continue to see. You'll often also need referrals in order to see specialists. Now, so you'll have to look, as some of these newer HMO plans do not require referrals to see a specialist. But they also don't have an out-of-network option, meaning that you'll want to stay in, or rather have to stay in network on the HMO. Now, on the PPO side, it offers a little more flexibility. You do not have to choose a primary care physician. You can also go to specialists without needing referrals. And another aspect is it does have an out-of-network portion of it. Now you'll want to be careful in this area. That doesn't just mean for the same amount you can go see whatever doctor you'd like, even if they're out of network. You'll most likely be paying more to see someone out of network under a PPO. Now it does offer a nice advantage in the sense that if there's an emergency or something goes wrong, you do have that flexibility to be able to go out of network, which is nice. So just to recap, a Medicare Advantage plan can come in two distinct areas. One is an MA, or Medicare Advantage, that does not have Part D built into it. The other and more common side is what's called an MAPD, or a Medicare Advantage prescription drug plan. It's important to know this, especially if you're going on a Medicare plan, that you get the prescription drug coverage built into it, as there's no other alternative or standalone products you can get. Now, another key area is a PPO versus an HMO. An HMO does not offer an out-of-network benefit. However, a PPO, while you'll pay more, does offer that out-of-network protection. Now, while most Medicare Advantage plans, not all, can be found for $0 per month, it does have things like copays, deductibles, and so forth, meaning you could and will pay money to use the services. For example, a primary care physician could be 0 to 10, a specialist 35 to 55. Again, those are just examples, but it kind of gets you an idea of how a Medicare Advantage plan will work and how it's more like traditional health insurance and that you have to cover these costs. So as you're making your decision, it's important to take these key pieces into account so that you can make a decision that's best for your health and financial circumstances.